The coronavirus outbreak has exposed deep inequalities in our society and shown just how vast they are, as African Americans and Latinos are dying at a much higher rate from this disease. We're going to talk about that with an expert next. So coronavirus has killed now more than 42,000 Americans, but the disparity in Black communities in cities like Chicago is just unbelievable. It highlights the inequality nationwide among Latinos as well. For African Americans, they account for 30% of Chicago's population, but make up nearly half of the city's cases and more than half of the city's deaths. I'm joined by Dr. Suzet McKinney, CEO and Executive Director of the Illinois Medical District. It's the country's second largest healthcare and technology district. You're focused on so much right now. Thanks for being with me.
Thank you.
Let's begin here. When you think about what's happening in the city of Chicago, it's happening in Detroit, it's happening in New Orleans, it's happening here in New York City. We had Chicago Mayor Lori Lightfoot on just last week talking about putting a real focus on these communities in your city where there is a disparity in healthcare, a disparity in terms of how many are contracting COVID and dying from it. Can you talk about the efforts, what is actually being done for those residents?
Sure. There's a concerted effort at this point, not just here in the city of Chicago, but across our state, to bring increased resources to vulnerable communities, particularly around testing. Mayor Lightfoot, I'm sure she spoke about her racial equity task force that is partnering with organizations that service these vulnerable communities to ensure that they have masks, to ensure that testing supplies are available so that those communities can be tested. And our Governor, J.B. Pritzker, has done a similar effort, partnering with federally qualified health centers to do the same.
The NAACP, as you know, is among the groups calling on lawmakers to address the disparity. I just wonder what can be done at this point. All of those things, increased testing, protective gear is all important. But look how many deaths we've already seen in these communities.
Sure.
I guess, what would your ask be to lawmakers?
You know, one of the things that I would say is that this problem is larger than COVID-19. You know, this is really a failure of our system to address inequalities in healthcare, in housing, in income, and economic disparities. And so the issue is COVID-19 today, but in a year, 3 years, 5 years, there will be another issue if we don't start to address this issue now. So my ask would be for us to take more of a systemic approach to addressing some of these issues that create these extreme disparities among certain communities.
You know, one of the efforts that you're leading is you're bringing basically shuttered hospitals in regions and parts of the state that need it most back online. Doing construction,
yes,
retraining medical professionals, and those should be open by the end of this month. Politico has really interesting reporting this morning, citing dozens of medical professionals there in Illinois. And they said one of the key issues is a lack of trust among many African Americans and Latinos in the healthcare system in general. Quote, the effect of those missteps has been exacerbated in the minority community that were already distrustful due to long-running racial inequalities in the healthcare system. How do you deal with something like that?
Well, you know, it's an unfortunate situation. There are long-standing issues around trust of the medical community. But I think one of the strategies that we've utilized to deal with that issue is calling upon community leaders and faith leaders to really join with us and help us to push messages down to communities and bring us into these communities so that we can begin to build more trusting relationships. One of the things that I think will be very helpful about the alternate care sites that we are bringing on board is that these are shuttered hospitals that are in communities where many of the vulnerable populations that we're talking about live. So I think there's some level of encouragement that they see that these facilities within their communities are being reopened, if you will, and that there's some sense of hope that the additional resources that are needed to combat COVID-19 are coming directly to their communities.
I hope so. Thank you for the work you're doing. Good luck on those hospitals you're reopening, Dr. Suzet McKinney. Thanks so much.
Thank you.